An investment into wellness, I think, is very important.
Flawless is a myth. The only thing flawless is your filters and your editing.
My acne was really bad. I hated my skin. तो इतनी काली है, तो तू क्या foundation लगाएगी? I'm trying everything, but it's not working out.
Your skin is the largest organ of your body, yet the most neglected.
What is the most common thing that women in India come to you with?
Get a good cleanser, get a moisturizer, get a sunscreen.
I've not taken off my mascara in 10 years.
I was like, oh, this is it. I don't want to change anything about me. If it's problematic skin, I'm just going to own up to it.
Botox, fillers, all these things exist. How do you manage that?
Makeup is like fashion. It can always amp your game.
I would never pay for a nutritionist.
Even I know that. And I'm not a dermatologist.
Stress is the new sugar.
She's attacking me. Yeah,
You know, I was the laziest person when it came to skincare. I can be very strict with myself about exercising, about eating right, sleeping on time. All of that I follow religiously. But there's one routine that I've sort of skimmed over, and that has been my skincare. And for the longest time, I told myself, it doesn't really matter. Looks aren't important, and I want to focus on my intellect, I want to focus on my work, or just being comfortable in my own skin, whatever state that was in. But then I turned 40 and I couldn't ignore certain changes. There was dryness, there was pigmentation, fine lines, puffiness, basically gravity happens, and I felt the need to do something. I've come to realize that skincare isn't just about vanity. It's actually about skin health. Just the way we take care of our body, with food and fitness, we can take care of our skin. Before we begin, I do want to share with all of you that this episode of All About Her on skincare is supported by Bioderma. And since today's topic is about skin and skincare, it felt like the perfect fit because one of the most important aspects of healthy skin is sun protection. And I actually use Bioderma sunscreen. They've been recommended to me by my dermatologist. And I want to be clear that while Bioderma is supporting this episode, our conversation, it stays completely honest, it stays unfiltered, and it stays science-backed. So, hello and welcome to All About Her, a space where we have honest and meaningful conversations about women's health, wellness, happiness, and skincare. And today we're discussing the importance of healthy skin. I'd like to introduce my guests. Our first guest is someone who has been refreshingly honest about her journey with skin. From struggling with severe acne to trying every possible fix and then sharing her wins and her failures openly, she has built a massive community that looks up to her for relatable and practical skincare advice. She's a creator, an entrepreneur, and a voice of authenticity in the beauty space. So please welcome Sarah Sarosh. Today I'm joined by a woman who has redefined what it means to be a dermatologist in India and beyond. She is a celebrity dermatologist and a trichologist trusted by some of the biggest names in Bollywood and sports. She's the founder and medical director of La Grace Luxury Skin Clinic and Longevity Lounge in Mumbai. She's also the co-founder of Skin Jewels, a luxury skincare brand where science meets indulgence. Please welcome Dr. Jyoti Aneja. Thank you, Dr. Jyoti. Thank you, Sarah, for being on today's episode. It means a lot to me because recently I've started looking in the mirror a lot more and really staring at myself. And I have lots of questions about good skin, healthy skin, how much I should be stressing about this or not. And I'll get to all of those. I thought I'll start with you, Sarah, by saying firstly, congratulations. You've hit more than 1.5 million subscribers on your channel.
Thank you.
That's a big deal.
Thank you so much.
There are so many people who are waiting for you to share advice, skin care tips. When did this all start? When did you first get onto YouTube?
I got on YouTube 8 years back. So that was literally when I was just 17, 18. And I had really problematic skin. Like I never thought I would be like a skinfluencer now that they call, this is a term that we use. Because I had problematic skin and I actually just wanted to use makeup. I loved makeup. I was not the skincare person. I wanted to hide my insecurities with makeup. I thought, I have acne. This is how my skin is. I'm just going to hide it.
Right.
So I just wanted the foundation, the concealer, and I just wanted makeup. And I loved makeup. And the more I learned from the creators in the West, I didn't have that reference point to learn from, because their skin tone was much different than what I was. The brands they were using was different to what I had in the market available for me. So I would go to the local store and shop and then show people the makeup we had in our, because that time we didn't have like Nykaa and stuff, right? We had a dukan, and I used to go to the dukan, and I remember very well each of the shop had all these beauty options, and they used to sell fake makeup also, but I used to, so I used to buy those products, and like not the fake ones but affordable ones, like the cheaper brands back then. I was in college, so I would reference those things and only do makeup videos. But then I realized I invested in this one serum that worked for me, and then I made like a before after video on the internet, and that like went viral. Like that video did really well. That's when I understood Indians really want, like people like, there are a lot of people like me who have problematic skin who are looking for a solution in a store. And this serum also I had bought because एक mall वाली lady ने मुझे recommend किया था. Like that was back then, those were the influencers, you know. So I made that video. Everybody on the internet was like, oh, this is sponsored, and I was like, what is sponsored? Like I don't even know what a sponsored review means back then.
Right.
So I just did it, and I was like, I am using this is working for me. Then I realized, oh, good skin health means something, and if I fix my skin, I won't need that much makeup, and I can wear my skin normally too with maybe just a lipstick. That's when that evolution of diving into skincare came. Then came Nykaa and that whole evolution of buying products online, trying new things, and then the lockdown, and I think everything after that was history. So
you're enjoying it.
Yeah, I love it. I love it.
And before I come to you, Dr. Jyoti, your relationship with your skin, Sarah, how would you describe that? When you're 18, for example, or even now in your mid-20s, how has that evolved?
It's evolved a lot. I think back then I hated my skin. I thought it was something was wrong with me because my mom didn't have problematic skin, my sister didn't have it, but I had it, and as growing up as a brown skin girl, anyways, I had that insecurity, you know, because when you're growing up, my sister's much more on the fairer complexion, my mom is, and my dad is, and so every time people looked at me, because I was a swimmer, I was much on the tan side, so everyone was like, oh, why do you look like this? You should put this, you should. The DIYs in the family conversations were endless, and it used to make me so irritated because I used to hate sitting in the bathroom and putting tomato and besan and all that on my face and hands, and it used to itch me, and I used to hate it. So when I came on YouTube and I started owning up to my skin and seeing how many people can relate to it, I was like, oh, this is it, you know. I don't want to change anything about me. If it's problematic skin, I'm just going to own up to it and this. But I think with age, I've understood that a lot was wrong with me hormonally, and you know, what I ate a lot of sugar, a lot of things. Like I've fixed my nutrition also quite a lot. So no longer do I rely only on external skincare. A lot of what I put inside me has also changed now, like 8 years down the line. And I think that's contributed majorly to, I love my skin now, and even if I get one pimple, I'm like, I definitely ate that laddu, and that's showing up on my face.
But that's wisdom. I'm saying, even you're very young, but even that evolution from an 18-year-old to someone in their mid-20s, there's a sense of, okay, a change. I don't think any 18-year-old thinks about what they're eating and how that's impacting their skin or their sleep or anything. I wanted to ask you, Dr. Jyoti, because you've been doing this for as long as you have. People come to you, presumably a lot of women come to you, I know you also treat men, with their skin. What is the most common thing that women in India come to you with?
The most common insecurity that women in India deal with is dullness. No one's happy in their skin. So, you know, I think 7 on 10 women coming to me on a daily basis enter saying, Doc, I think I lack the glow.
Right.
My skin feels dull. Acne pigmentation, most definitely yes, that's like a struggle that is constant. But there's one unhappy factor that we all have, that is dullness. And we all think we're looking for glow in a cream, we're looking for glow in a box. So that's where the education starts, that's where the journey starts. We have to unlearn a lot of things. There are so many things that you already have preconceived notions that you come to us with. You've already tried so many DIYs at home before you hit the doctor.
Right.
Your skin is the largest organ of your body, yet the most neglected one. You know, something goes wrong with your heart, lung, liver, kidney, the whole family panics. You know, you do your blood tests, you will run your reports, you'll do everything. You want opinion, second opinion, the whole family is panicking. You get a pigmentation patch on your skin, you will hide it for the longest. Like she rightly said, you know, you try to conceal it with makeup.
Yes.
You are going to try and not face it for as long as you can.
Yes.
Till you can hide it no more, and somebody says, oh, what's wrong with your face?
Right.
Did you not sleep well? Your eyes look very tired.
Yeah.
what is this? Why is this acne suddenly coming on? And then that's when you be like, you know what, I think now I need to go see a doctor.
Right.
And by then the scars are already setting in.
Right.
Which are so much more harder to treat than the acne itself.
Right. So you're saying even before it shows on your skin,
Absolutely.
if there's certain things that you adopt in a preemptive way, then you can have healthy skin.
100%.
What is, Dr. Jyoti, according to you, healthy skin? Is it glow, texture? Is it one skin fits all? Does it go deeper than that? Just to understand, because I don't think that everybody understands that everybody's skin is different. Nobody wants to look the same.
True.
And thankfully, that message
Absolutely.
is seeping through to people.
Absolutely. Yeah.
So I'm assuming that obviously that is your thinking also, that not everybody wants to look the same, but everybody wants to be healthy and have healthy skin.
Yes.
So what is healthy skin?
So the first thing that I want to bust here is flawless is a myth. The only thing flawless is your filters and your editing. Those are the digital concealers we hide behind, which is absolutely okay too.
Yeah.
But if you think the glass skin, the Korean skin that we see on the screen all the time, that's not real. That's not a healthy skin. A healthy skin is the one which is hydrated. It's something which is bouncing back. The barrier is intact. When you apply your makeup, you need very little makeup, right? And it just ups your game. It just takes you from a 1 to 10. Your canvas is clean. A healthy skin is the one that bounces back. If you get acne, you don't scar. If you have tan, you come back. Like if you've gone on a vacation, you undo with the tan. You shouldn't be, like you said, we were having this conversation before we started, right? We're scared to go out in the sun now on a vacation because we think we're going to come back with a tan.
Yes.
It's okay. That's a healthy tan, right? And there are healthier ways to get away with that tan as well. So a healthy skin is something that will bounce back.
Right.
It's as simple as that. It's like being on a trampoline.
Does your skin stay the same? Is your skin static through the ages, or does it change?
Absolutely not static. It's in 100% dynamic moment. A teen who was oily by 15 tends to turn suddenly combination in the mid-30s, and by the time we're hitting like a perimenopause, menopause, we tend to turn dry.
Yes.
Right? So it's basically the hormones that are changing. It's the environment that you're living in changes. You change cities, you change makeup, you change products. Everything around you is changing, right? So we're ever evolving.
Right.
So your skin type tends to stay the same in a few people, but in most of us it does change because there are so many factors. Stress is the new sugar.
Right.
Right? So if you're stressed out, you're going to look old at a 20. Like
How do you not get stressed out?
I want to ask that for sure.
So there's nothing like being stress-free, but there are better ways of combating stress. You figure a life around the stress. You identify your triggers, you identify your stressors, and then you find out what calms me down also.
Right.
So you take out time for those things and become a happier person.
Do you know your skin type?
That's what when she said that it's hormonal, I can agree with this because I used to be oily like in my teenage, like very oily, because all the acne also used to look like very glossy on camera. She hated, and I should always say oily skin, oily skin, oily skin, and then suddenly I'm like, oh, my skin's dry, because now when I'm taking off makeup, my skin's become very dry. So I immediately need a moisturizer, otherwise I don't like that icky feeling of dryness on my skin. So my skin has changed, and I couldn't quite put a finger on it, but yeah, now in 8 years now I'm like dry, and like if I'll sit say in front of these lights for very long, then I can get like an oily T-zone, but that's it, like it's slightly combination. So
Right. What are the different skin types, Dr. Jyoti?
So just to broadly tell you that, it's basically you have a normal skin, an oily skin, an acne-prone skin. That is, you've got sensitive skin and a dry skin. So combination skin is where most of us lie, right? Like we've got a T-zone that's oily, we've got our cheeks that are relatively dry, the next skin is thinner, so that's also relatively drier. So you've got oily skin, you've got normal skin, sensitive skin, and a combination skin.
What skin type am I? I feel like, as you were talking, you were looking at me, and I was like, I feel like you're looking at me and saying,
I feel you're an absolutely normal skin. This is like the greatest skin to have.
I think you're a very polite guest.
No, I
And a very honest one too.
Yeah, like when I saw you for the first time, I was like, your skin looks better. Like I can't see the makeup.
Yeah.
So
Thanks. I don't know whether that's Arjun, my makeup artist, or me, or genetics, but we'll come to that. And I have many questions in terms of even my normal skin, which is now on the drier side,
Right.
perimenopause and things, mid-40s,
Right.
the environment, lots of things that we deal with, hormonal change. I will get my free consultation from you in just a little bit.
Happily so.
But first, to come to you, Sarah, you mentioned that your formative years when you were growing up, it was challenging for you, the brown skin, the problematic skin. By problematic skin, what do you mean?
the fact that I would get an acne, like my acne was really bad. Like it was pus filled, there was bacterial, fungal, and I think hormonal.
Right.
So I had really painful pimples, not the kind that you get like one zit or two. My cheeks were filled with acne, and even sleeping on that used to be painful.
Yeah.
So this was not just visual insecurity. It was also the fact that it would pain, it would hurt to even wash my face. So, but every time I went to the dermatologist, they gave me isotret or something on those lines, which drugs that didn't suit me. I was also put on birth control when I was like, for this reason, for my acne, and that while it was on, it was fine. But then the minute you stop the drug, the skin is back, it bounces back. So those kind of issues is why I became that stubborn person where I was like, okay, this is my skin, I gotta accept it.
Right.
I wanted to have that acceptance, because every time I went to the doctor, it was not fixing it. It was just bouncing back, and I was having very like disappointing experiences with the drugs I was taking. Now I know there are much better drugs in the market, like for acne and like for everything else. But back then, these were the drugs which were prescribed. And they also had a lot of side effects like mood swings and weight gain. And then, to deal with all that when you're a teenager, it's a handful.
Right.
And people are not kind to you. Like, I would have this professor in college to irritate the hell out of me. Every time she used to look at me, she used to be like, you should fix this, you should do something. And because I went to the hospital as a college, they would just expect me to go to the dermat ward and get it fixed. And I'm like, I'm coming here to study. Can you just focus on my studies? I don't want to go to the hospital's dermat. I will go to my own dermat when I have time on the weekends. But this freaka gyan that teachers would want to give was so irritating. I was like, what do you think? I don't see my face in the mirror every day.
Yeah.
I do realize I'm trying everything, but it's not working out. A very irritating period of my life for sure.
I think that people like to comment on appearances, whether it's your weight or it's your skin. These are things that are obvious, and I don't think any conversation goes by when you meet someone after a time. You say, oh, you put on weight or you've lost weight.
That's a very sad conversation starter.
I hate that. That's a conversation starter. I'm like, you can ask me anything, but why do you have to comment on the way I look?
And this is something that, again, whether it's adolescence, whether it's puberty, and let me tell you, it also comes later in life. Acne doesn't end when you're teenagers.
Yes.
It comes back to visit you, and we can talk about that also. But it is a problematic time anyway, as you said, to be a teenager, and you're dealing with so much.
Right.
At that point, to choose to share your story bravely and to connect with people and to look for that community, or just to try and normalize things, look for help, the intent behind you sharing your story. Tell us a little bit about that.
See, there's every side of the internet. I think while I was building a community, there were a lot of people who could relate to my skin type, my problems, and that community was building stitch by stitch. But every time a video would go viral, or there were way too many views, or it would reach the wrong side of the internet as per the algorithm, there would be like all these suggestions coming in the comments that pehle apni skin theek kara le, pehle, ज्ञान देने से पहले तुम पहले अपने आप को देखो, अपनी स्किन ठीक कर. आज भी मुझे आते हैं कि अरे तू तो इतनी काली है तो तू क्या फाउंडेशन लगाएगी, those when it reaches that side of the internet. Today I have a thick skin to the internet. I'm like, oh, you're engaging on my content, amazing, you're giving me engagement, superb, please do more of it.
Right.
So that is my attitude now. Of course, back then I would get very disheartened when I used to see those comments. I used to be insecure, to pinch more of the part of me which was anyways insecure, was like it was hurting more on that side. It takes time to sort of build that barrier around you, while your skin is getting better, you also want to build that around you. But I think only because I was always authentic with my journey online, have people been able to relate to it, and they know what my skin looks like now is not how it was back then. So I think a lot of teenagers, one big message that they can pick up from my journey is that it gets better. It really does get better. Like today I can't even see my acne marks. There was a full phase when I used to apply foundation, you could see the pitting. The foundation used to sink in the acne scarring, because I in stress I used to pinch my acne also, which is not recommended at all. And
I know that. And I'm not a dermatologist.
Exactly. I knew that, but I'm giving my exam and I'm like pinching the pimples because I couldn't get an answer, and that was like a stress buster. So those things had ruined my skin so much, and with the right dermats that I met later, and now I have one dermat that's fixed. I go to that person and I'm like, okay, I get like I've vlogged everything. So I've vlogged my skin treatments, I've vlogged the good experiences, the bad, I've shared everything on my channel, so people can really reference and see, okay, she did all this and her skin got better with time. So if they stay patient and they go to the right people and they eat the right food, it's gonna get better.
That's so amazing to actually follow your journey and the good and the bad. And I think when you show the good and the bad, then people trust that authenticity, because it can't just always be good. It can't always be the right profile, guys, even though I really try sometimes. It escapes. I want to ask you, Dr. Jyoti, because of course Sarah mentioned a few of the things that she turned to. There was a mention of vitamin A and isoretinoin. There was a mention of tomato and other homemade remedies that you use to battle acne. And then you said there are other better drugs that are in the market today.
Yes.
So what are, if somebody comes to you, at the age of 18 even, which is the time, I guess, when you're young,
Yes.
later in life also, you don't want to take, nobody wants to take too much medication.
Right.
What is something that you would advise somebody who has acne?
I would say start with a clean skin. Keep your skin clean, and less is more. You don't have to do everything that's under the sun. There is no cookie cutter approach. What worked for me may not work for you. It's like, hormonal acne loves the jawline. It's the product acne that shows up on the cheek. Lifestyle acne usually loves the forehead, but then
Okay, wait, stop. Sorry. Tell me more about that. You said there's different acne is caused by different things.
Yes.
It's not just I left my
100%.
makeup on, my pores got
Yes.
clogged and this results in
Yes.
acne. It's not just genetics. It could be
100%.
various reasons. So what are the different reasons for getting acne, and how do you know what kind of acne you have depending on where it shows up on your
Again,
face?
so like she said, she had a crop of acne on the face. It wasn't one odd acne. One or two acne during our periods is absolutely normal. Now girls are hitting menarche really early, right?
10, I believe.
Exactly. So, and you see acne by the age of 12 and 13. What are you going to give a 12 or 13-year-old that she's going to follow through?
Yeah.
Tell her to just wash her face with a cleanser, apply her sunscreen, and be okay with it. Do not pick on the acne. Like you said, you know it, she knew it, but it's a stress itch.
Right.
It's a stress itch. You tend to bust your acne, and it's, if I keep it very simple with you, we have a classroom. We've got the front benches and the back benches, and the back benches are always the naughty kids. So if the back benches fall down and they have a scab, they pick on the scab, right? And if you pick on the scab, the skin underneath is either dark pink or brown. It leaves a mark. But the kid sitting in the front is always scared. Scared of the teacher, scared of the mothers, never going to touch. So who's got more marks? The kids at the back always. Similarly with your acne. If you do not touch your acne, it'll not leave you a mark, right? But if you pick on it, most definitely, yes, it is going to leave behind a scar, and that could be hyperpigmented scar, it could be a depressed scar, it could just be an ice pick scar which looks like an open pore, but it's the deepest of all the scars that we have for acne. Right. So having said that, this was about the scars and how the acne scars. But when you say what causes acne, acne could be caused by hormones. It could be my genetics. It could just be my lifestyle.
Right.
So like she said, she was doing everything right. She was taking the medications. She was even put on birth control to do the hormonal bit for it. But who fixed the lifestyle for her? Right? So that's where history taking comes into the picture. You have to speak to a child for easy 20-30 minutes before you write a prescription for a 20-year-old. Right? Because what goes on the inside reflects on the outside.
Right.
If she is taking the medications and eating processed food all day long, not eating on time, popping her acne, nothing's really going to work.
Right.
It's going to tide over while you're doing the medication, but the moment you stop, it's going to bounce back.
Right.
It's going to come back, and it's going to come back with a vengeance. And that's when you lose faith in medications. You lose faith in the concept of your doctors, and then you be like, you know what, I make my peace with it, and it's not going anywhere, it's here to stay, so let me just figure a way to conceal it.
Right.
But if you find out the why, the cause, you can treat the symptoms.
Sure.
It is we live in Bombay, we want everything in a quick Bombay minute, right? But good skin takes time. It's like a gym membership. Just taking the membership at the best gym in Bombay is not going to give me the body I desire. I'm going to have to show up.
Right.
Consistency is the key. I am going to have to handhold my doctor. I'm going to have to share. Ki, doc, you know what? This medication I use for last 15 days doesn't work for me. Change. That's all right. So doctor hopping doesn't help. Doctor shopping doesn't help. You have to stay true to the person. Go to somebody you relate to.
Right.
If somebody you feel this person does not have the time for me, probably is not the doctor for you. Go to somebody who listens to you. They need to know your story. They need to know where you're coming from. Like I said, stress is a big trigger.
But I'm saying your expertise has to come in terms of not just looking at what's on the outside
100%.
and giving a prescription, but actually spending some time. And so similarly, the person on the other side of the table needs to have some patience.
Yes.
And there's the process. But assume that person is eating well and sleeping well and is in a relatively stress-free environment, and they do come to you with acne, which a lot of teenagers, I know there's lifestyle changes now and there's diet changes, but they come to you. Do people still prescribe birth control?
So yes, if at all there is any hormonal basis, in my practice I'm not a big fan, but yes, there are patients who need it, and then in that case we loop in a gynecologist. I like it that way. It's like, you leave it to the experts.
Right.
Because there's a lot going on in the skincare business, which I think I would know more than a hormone doctor would. So if I need an endocrinologist or a gynecologist, I'd much rather loop them, have my patient go to them and just discuss hormones, and come to me and we discuss skin. So, it just goes hand in hand. The patient also feels taken care of, and you don't end up over-medicating the patient.
Right. When did you go to the dermatologist? At what point? When you tried all the OTCs and you tried the home remedies, you got tired of the tomato?
Yeah, I think I've had a dermat at every stage. Like even at 18 when I had acne, I had a dermat, and I'm not saying that it didn't help me. Birth control helped me. And with that I did lifestyle changes also, because the doctor back then also told me that this is like a band-aid, and if you do lifestyle modifications with this, you're going to fix the problem in itself. This is only going to put a band-aid on the gutter which has to keep flowing, you know. So you have to fix that dirt which is in your bloodstream.
So that was one, the nutrition you said.
Yes,
and
and exercise. For me, honestly, nutrition at that age, like you said, I was a teenager.
Yeah.
I was not going to stop my processed foods, and like I was not eating so much junk. But when you're taking a train, you eat a vada pav, you eat a samosa at the station. जो भी normal बच्चे लोग करते हैं वो सब I was doing with my friends.
अभी भी करते हो?
अभी मैं बच्ची नहीं हूँ.
फिर भी
नहीं, अब मैं नहीं करते, मैं बहुत ज़्यादा केयरफुल हूँ. बट अभी ये चाइनीज़ भेल खा लिया, लाइक कुछ भी रस्ते
लोग 20s और 30s में अभी भी ये करते हैं.
नहीं, मैं तो बहुत जल्दी बड़ी हो गई घर पे बैठे बैठे पहुँच. तो नहीं, बट कॉलेज में तो बहुत बकवास खाया. बट तभी जब ये बर्थ कंट्रोल के साथ ही टोल्ड मी कि इफ नाउ आई डू लाइफस्टाइल मॉडिफिकेशंस इट विल हेल्प मी, started working out, and I started working out really religiously. So because I had like 7 o'clock, I had to catch the train, so wake up at 5, go in the garden, work out 5:30 to 6:30, come back home, run, have a bath, take the leave or the train. मेरी 8:30 की अंधेरी local होती थी, and I used to take that. So this was my routine, which was so nice, because in college, come back, you're tired, you go to sleep, eat food and go to sleep. This routine, I have been the fittest I was ever in my life. My hair was looking good, my skin was looking good, stress was managed, and I was not like focusing too much on what's on the plate. It was just the rhythm, the balance, the whole circadian rhythm was so like properly in place.
Do you still have routine in your life? Why?
Because entrepreneurial life has no routine. Like,
but still, I mean,
wish, I swear, so I wish.
You can still wake up at 5:30.
No. Now it's like
I called you at 12 o'clock and she said I'm half asleep.
Yeah, she called me at 12 p.m. I'm in sleep.
So what do you mean entrepreneurial life? What time are you sleeping?
I'm sleeping at 3. I sleep at 3:30 also. I have really bad work-life balance at this point because my office is my home.
So now because your skin is sorted, you're like, I can take a few chances.
No, so now I really now have to eat clean because I'm like everything else in my life is all over the place. At least I can focus on the nutrition. Because sleep, I still try to get, like if I sleep at 3 also, I try to wake up 10:30, so 7 hours. Like my sleep is sacred, nobody disturbs it. And then I'm like non-stop in work mode. So stress, so you can't manage only. Like there's no, I'm like only if I get a workout, the serotonin is going to help it. But apart from that, it's all over the place for sure. So now the focus that I keep on is nutrition.
Right.
That okay, this is my core thing. I can control the sugar, control the glycemic index in the food, because I've seen that difference. Like I have a nutritionist now, so with as you age, you have money, you can do all this.
I think as you age in your mid-20s, to saying as you age.
I know. I'm like, certain things like I would never pay for a nutritionist. I would genuinely never pay for a nutritionist. And now that I do, I'm like, okay, it makes a lot of sense. Like what he's saying makes a lot of sense. It's actually helped me a lot. So I'm going to continue to do this. But fix my sleep, but actually fix my diet.
And investment into wellness, I think, is very important.
For sure.
Whether it's nutrition, whether it's a fitness expert who will give you the motivation. Before we come to exercise, I know exercise, nutrition are key building blocks in terms of good skin. What's the right time to go and see you? For example, if I'm young, in my teenagers, in my 20s, if I have acne, if I have pigmentation, how much can I handle? Like, Sarah said, we like going to a dukan and we like going to a shop and finding a solution. That's what she's doing also on YouTube, is giving solutions. Some people don't want to go to a dermatologist, may not be able to fit that into their budget, may not have access. So what is the right time to go to a dermatologist? How much can we handle with just OTC stuff?
Listen to your body.
Okay.
When you look at yourself in the mirror and there's something you're not happy about and you think you need help, seek help.
Yeah.
It's as simple as that. And if you do not want to invest as is right now, just start with the holy trinity of right skincare products, right? Get a good cleanser, get a moisturizer, get a sunscreen. So, the most beautiful thing you'll wear in your 50s is a sunscreen in your 20s.
Yeah.
Right? So if you're confused about your sunscreen, go see a doctor.
Right.
Because, the most common confusion that we all come across is, doc, sunscreen doesn't suit me. There are about 2,500 products we have in our Indian market, right? If one doesn't suit you, we'll find you another one, right? But let us help you, right? If you don't ask me a question, I'll not know what answer you're looking for, right? So if you come to me, most definitely, it's like whenever you feel uncomfortable is the time you see me.
Right. Nice. Those basic building blocks, not of nutrition and physical fitness, but like you said, the building blocks to healthy skin that we all should be doing, irrespective of our age, irrespective of our skin type, irrespective of our skin color. For me, I've been told it's cleansing, hydrating and protecting.
True.
Still the same?
Yes, absolutely.
Okay.
Easy, simple. It is basically uncomplicating skincare. You focus on protection in the morning and repair at night. Right? So all that you're doing is you're doing it right, you're doing the cleansing, you're doing your moisturizing and you're applying a sunscreen in the morning. At bedtime, you again cleanse, you moisturize and apply a repair serum.
Right.
Simple as that. 3 steps. It does not have to be 10 steps.
Right.
It just has to be 3 steps over 10 months. Consistency is the key.
What is your skincare regimen like on a day-to-day basis?
It's pretty much what doctor said. Like I do cleanse, serum, moisturize and sunscreen in the morning. If I'm feeling like a little, like my skin's a little oily, or the weather dictates it, or where I'm going. Today, like for example, I didn't apply moisturizer because I knew there would be lights. I'd get oily. So I'll just do sunscreen. I'll do cleanse, serum and then sunscreen. I skip moisturizer. In the night, if I'm feeling fancy, I'll go ahead, I'll do a face mask on the weekends and stuff, but otherwise just again, I do double cleansing because I apply makeup almost every day.
Double cleansing is?
Like a cleansing balm, then I use a micellar water for like the patches which I have makeup still, then I'll use a face wash. It's almost triple, right? And then serum and moisturizer, that's it. Yeah, no sunscreen in the night.
My husband is always like, you go into the bathroom and you disappear for a very long time. It's not true actually. Mine is also quite basic. What happens if I never take off my mascara?
Oh, that's a very good question.
There is no way you're not taking off your mascara.
I'm not taking off
You
my
have to. So
I've not taken off my mascara in 10 years.
So you know what's going to happen is you're going to lose your lashes.
Don't tell me.
And you don't want to do that.
No, that's why I'm never going to take them off now.
So now what you do is just take simple Vaseline if you're really bored, right? Just take that on a Q-tip and clean your eyes with that before you go in for a face wash. Emulsify the mascara. Because you know, we're all so used to using a waterproof mascara. We want it to last all day. We're very lazy.
Yeah.
We don't want to reapply it. And you know, once you apply it, it's very kadak. And
Yes,
you know, reapplying it doesn't feel good. So we feel, okay, let me just sleep with this on. That's when you wake up in the morning, that the pigment, again, if you're leaving the pigment on, you're going to wake up with dark circles. Because over the years, you are depositing one pigment around your eyes on a regular basis. And this skin is 6 times thinner than the rest of your face.
This skin.
Yes. Right? So you're leaving the pigment on, plus you're being lazy, and it is a dark pigment at the end of the day, right? So this skin tends to be darker. We're genetically predisposed to dark circles. We have sunken eyes. That's just how our skull is, right? So on top of it, if I leave the mascara on, that's a sin. That's not something you're doing today on. That changes.
I'm going to go home and put Vaseline.
Easy. That's easy. Like if you don't have a cleansing balm, we all have a Vaseline at home or any.
I have a cleansing balm, so I'm going to go and put a cleansing
just
balm.
apply-
These cleansing balms are also not removing the waterproof ones. That's why I use washable
That's very
mascara. I'm
correct.
like, they're so stubborn. 1-2 lashes to come out only in trying to remove.
So that needs to change.
I will. My mother's telling me this, and you talked about this emollient. That's my visual of my mother going to shoot, coming home, putting on some kind of oil around her eyes, removing her eye makeup, and then putting on an emollient cream, and that's all that she would do. So these, I think, are the basics.
Absolutely.
And one basic that people have told me also is sunscreen. Very important to protect your skin, which we all realize. Sometimes you remember, like you did today. Sometimes you forget, like I did today. And I will ask you also whether it's important when it's cloudy. Some people know the answers, some people don't know the answers, and they, I think, require, like me, a little bit of awareness and education. When it comes to sunscreen, for example, there's lots of numbers, 30, 50, 80, I don't know how high it goes. How high does it go?
Yeah. So you don't get lost in the numbers.
Okay.
I'll give you some basics here.
Okay.
So you've got SPF and you've got PA.
So SPF is your sun protection factor,
right? So that is the protection from UVB rays.
Right.
Right? And your PA is your protection from UVA rays. Usually, any of the sunscreens that we're looking at are broad spectrum sunscreens, which give us SPF as well as a PA. Right? So when you say a SPF 30, it gives us about 97% protection from the sun. And when you say SPF 50, it gives us about 98% protection from the sun. So the difference is not so big, right? And when you say a PA 3++, it's just about enough protection. The idea is reapplication. Be it a 30, be it a 50, it has to be reapplied every 3 to 4 hours because you're going to be naked again in 3 to 4 hours time. So you have to reapply your sunscreen. That's the key. If a product that's 50 feels a little heavy on your skin, go in with a 30, no problem at all. SPF 30, PA+++, no problem. But reapply. That's the key.
But what if I'm wearing makeup?
Again, if you're wearing makeup, how you layer your makeup is the key. You're going to not leave from home with the makeup on. So apply your sunscreen as a base while you're on the way. Once you get onto the shoot, put your makeup, all your makeup dadas know this, that you apply your sunscreen as a base, like how you apply a primer. Apply your sunscreen then you apply your makeup on top of that. Understandable, with all the makeup that we have, we cannot reapply sunscreen on top of that, though we do have sunscreen powders also now.
Sunscreen what?
Sunscreen powders that are available, the compacts that are available. But that's not practically possible for most of us, especially the lazy girls who don't want to do anything.
How effective is the sunscreen powder or a
It is pretty
stick?
effective. It is a mineral sunscreen. It is giving you physical protection at the end of the day, but you don't like the way it meddles with your makeup.
Right.
So if you apply it even twice, I'd be more than happy. But you do have to reapply it. And then after the end of the day, because we're in harsh lights, right? We have to protect ourselves. It's basic. It's like, and once you get used to it, you feel naked without it.
Right.
So you cannot step out without a sunscreen. You'd be like, you know what, I'm okay without anything else, but I have to apply my sunscreen and go out.
And this isn't just for us as working professionals in front of
Everyone.
lights. It's for everybody.
Everybody. And you apply it 20 minutes before leaving. You don't just apply and go out, because you know, it's human error. You're going to apply it, you're going to just smoothen it out. First of all, you take about 2 fingers, you apply, you make some dots on your face and you smoothen it out. You don't massage it like a moisturizer. It is not a moisturizer. It's supposed to form a film, a protective layer onto your face, right? And with those 15-20 minutes that you give, the molecules form a barrier, the web that's formed, that gives you 100% protection. So that's why you have to let that time pass.
So, sorry to interrupt, you cleanse, you hydrate,
Yes.
then you put the
Sunscreen.
sunscreen, and then you let it rest for 20 minutes or so, and then over that you put on the makeup that you want
Yes.
to or not want
Yes.
to over that. That is
Yes.
the process.
Absolutely.
And then you reapply.
And if you want to apply your serums, they have to be before your sunscreen.
Okay.
Yeah.
So Kunal is saying you're taking some time. But you can still be,
Minutes,
but you can
like
still.
I did apply
No, I'm probably
sunscreen.
answering some messages also while I'm
It's like,
doing
you know,
it
if I
on
tell
the
you
phone.
20, the least you're going to do is 10.
Yeah, that's what I
but
applied my sunscreen. I walked around the house and
that's
came
pretty
back
much
and I applied
okay,
makeup.
right? But you have to let some time pass for the film to form
Yes.
onto your face.
This I'm thinking about my daughter also, because you know
Yes.
often we go swimming
Yes.
and just before she jumps in the pool I'm covering her with sunscreen, and
Apply
Kunal's
it.
like, no, it should have been done
Yes.
before we left the house.
Yeah.
And
True.
I'm
That's
like,
my
yes,
thing.
okay, but let me just do it now. We've all faced some issues with sunscreen, Sarah. I don't know about you, but I've felt that some of them feel very sticky.
Yes. True.
Some of them leave that white cast
Yeah.
where you look a little like a bhoot. So what's your...
I used to have sunscreen trauma because Mama used to apply sunscreen and she's very regular with her sunscreen. One thing my mother has done in her skincare is sunscreen. She's forgotten her neck and she's only applied on her face.
Yeah.
Today you should see her face is like baby skin and her neck has aged. And she's a classical example of the mistake to not me. But her skin actually is proof that if you apply sunscreen, you get, because she's a tuition teacher, so she used to go to her tuitions in the afternoon after finishing all our housework in the morning. She apply the sunscreen and make like a white booth, and she'd be, "Mummy, you're looking so funny." She's like, "वो पिघल जाएगा बाहर जाके." So that was her funda कि वो धूप में जाके पिघल जाएगा. So I used to just not like how her skin used to look when she used to leave the house, you know, greasy, oily and white. And so I avoided sunscreen for the longest time as a product, no matter how fancier the sunscreens on the market got and like amazing formulations came. I never, even when my Dermat said, I was like, no, this is going to be chip chipa. I just didn't want to try it also. I was like, no trauma. Like, it looks bad, I'm not going to put it. Already oily skin, and then you put that sunscreen and become more oily and look funny. I don't want it.
Right.
Then of course, as a content creator, I started getting so much PR, and then now I enjoy trying new skincare.
Yeah,
so
you
now
must
it's
get lots of packages.
Oh, God, every day. So every day I'm trying new sunscreen. Now I'm very like happy with everything that we have on the market. I think there's something for everyone.
Yeah.
But yeah.
So what I've understood that it's not one sunscreen fits all. I had issues with my sunscreens. I felt that they were too sticky. I also have dry skin. And so when I went to the dermatologist, he actually said, you need something for your skin. And he recommended and put on a prescription, Bioderma Photoderm Creme. And that's really worked for me, especially because A, I don't have to use a moisturizer before I use the sunscreen. It really hydrates my skin.
Right.
And so now that, like you're going on holiday, when I go on holiday to the beach, that goes with me everywhere, and I feel that it really works.
It does.
So it's not one sunscreen fits all.
It definitely is not, but most definitely yes, Bioderma per se is one of my favorite brands as well for the kind of research that goes behind the product. It's a very trusted brand, the quality of the product is great, and the skin is still breathable.
Yeah.
You can still put your makeup on top of that, and it just lets you reapply it. You know, it gives you the comfort of reapplication because you are not feeling like you're under a product.
It's not heavy
It
at all.
definitely is not heavy. It's a light on skin kind of a product.
And it's a French brand?
It is a French brand, yes. And what I like about the brand per se is it's
Yeah.
got brilliant sunscreens which are pigmented. So, it does away with your need for a BB cream or a CC cream or a foundation when you're on a vacation. And it does make sunscreen for oily and dry skin as well.
Right.
So they feel very light on your skin and you don't mind reapplying them again.
And that's why I went to my dermatologist. And he in fact put Bioderma Photoderm Creme on my prescription because that is the right sunscreen for sensitive skin.
Yes, it works really well on sensitive skin.
Lovely.
How good are spray sunscreens, like for beach holidays and stuff?
They're very convenient.
Yeah.
So I feel they're great because you end up applying them. They're easy, they're like a deodorant. So, you'll end up applying it all over your face. We do not have the Western influence as yet where we sit down and apply sunscreen on our backs and our legs and whatever. We just head out.
Right.
So if you have a spray sunscreen, I think it's the convenience, it's the ease that makes it very, very accessible and something that people end up using.
Right.
So
yeah.
I think it's great. It's
For
better
the
than not
beach
applying.
holidays,
Yeah.
like that's my one
Absolutely.
thing
It's-
that, okay, I'm
yeah.
going to carry on a beach.
Yes.
In my 40s, firstly, I choose my beach holidays very carefully. And then sunscreen is the must, not just for me,
Yeah.
for the babies
Yes.
and also for the men.
Yes.
Important to use sunscreen. no?
100%.
At what age do you start applying on babies?
That's a good question, but there are sunscreens that come for babies as
Yes.
well
Okay.
that are safe for children. But Dr. Jyoti, tell us.
I believe physical protection is better for children earlier on because we don't want to really occlude their skin. So I would say 2 to 3 years plus, when we start exposing them to water, we start taking them out
Yes.
on a longer vacation. So 3 years plus is easy, convenient that you apply your.
So you mean physical protection means clothes,
Yes, clothes, hats,
things like that until
you give them goggles because you want them to synthesize their vitamin D. They should be okay. And Indian skin, we are blessed. We have the right amount of melanin, which gives us the tan.
Yeah.
And which gives us the beautiful complexion that we have also.
Yeah.
So that saves us to a
Right.
great extent. And as a child, you're really over exfoliating. Your skin is in a great zone.
Yeah.
So you really don't have to do a lot as long as you're physically protected. And once you start heading out in the waters regularly, 3+, and you use your
I
sunscreen.
see all these moms taking their babies in the pool and then,
Yeah.
small babies. And I'm
have
like,
to
why
protect.
are you-
baby skin, but I think even
Yeah.
my skin and our skin, all of us should be protecting our skin.
100%.
Also because you said that makeup is something that you're passionate about and something obviously as a young girl you enjoyed,
Right.
and even now.
Yeah.
How do you balance makeup with healthy skin? Because we all know that when you put on makeup, or we all worry that when you put on makeup, it's clogging your pores, it's perhaps damaging your skin in some way. I
Right.
know we have lots of great products now in the
Yeah.
market, but with you wearing makeup every day, how do you balance that?
I think I think even now I don't care that much about like the damage it's doing to my skin. I'm not that worried about the clogging of pores and stuff. I'm like, okay, I have skincare, I'll take care of it. But there are a lot of like skin friendly makeup brands, right?
Yes.
There are lots of them, and they are also doing great foundations, great skin tints. Now that Korean evolution of makeup started in India also, and we love everything Korean. I think Korean fandom's crazy in India. I don't understand it, but it's
With
like
children, tell me about K-pop demon hunters.
oh my god, with everything, with music, with makeup, with whatever they do, we want to do it. And while they have some great products that I truly really love, I think initially when I started trying Korean skincare, it should not work for me, and I used to be absolutely against it because I was like, this is not working for me because Indian weather does not support Korean skincare. They are all about the layering and the multiple layers, the multiple ooey products, which the textures are very like sticky, and you step out with that and your skin's going to look horrible, your makeup's going to look horrible. But now I think they are coming up with a law, like lately, this started like a couple of years back. Lately, Korean skincare has a lot of different textures which will work for our skin also, our climate also, and even in makeup they're very inclusive. Coming to your question of how I layer makeup, there are days like if I'm on an everyday basis, I know this week I have a shoot every day, I'll mostly use like a skin tint now. Since I am having a better skin now, I don't need to conceal I don't need full coverage anymore. There's some days I'll just do concealer also. In fact, I don't have deep set eyes and I don't have pigmentation around the eyes, so I can skip concealer if I want. I'm more of the foundation skin tint person. If I have like a shoot like this, which is with heavy cameras, then I'll use a like more full coverage foundation. So I think that is one major thing, the base product. Secondly, I like to invest in my base. I always used to say that because that directly goes on my face. So when it comes to blush, when it comes to foundation, I don't mess because they go on. My cheek used to always be the problematic region, you know, and I realized it's because my highlighter brush is dirty and my blush brush is dirty, you know. So now I love my fingers. I don't even use brushes
I
that
also use
much.
my fingers.
Yeah, like I'm blush like this, highlighter I don't put anymore. Only for concealer I'm using a brush because under eyes you can't get pimples. So under eyes, and like every day I have Satyam clean my brushes on like one activity.
But I'm just worried they won't dry properly, and that's it's.
Buy so many brushes. You have like 2-3 batches,
Okay.
but that's my main thing. I wash brushes every single day after every use, and use my fingers as much as possible.
That's a very good tip because I also use my fingers because I'm just a bit lazy when it comes to washing the brushes and I don't have so many brushes. I just have a few and I'm worried that they won't dry in time. Dr. Jyoti, tell me about makeup. I know you're into skincare, but we all wear a little bit of makeup and we all sometimes stop and think, you know, we don't put makeup on our children, we don't want to spoil their skin. They're naturally blessed, and when we get older, all of us require a little bit of dressing up and we enjoy it. Is it doing damage to our skin? If we cleanse it properly, is that okay? Is too much bad?
See, again, makeup is like fashion. It can always amp your game.
Yeah.
But doing it right is where the key lies, right? Less is more. If your skin is great, like she said, she doesn't need a lot now.
Right.
There was a time she was concealing, but makeup should not be a mask.
Right.
You can amplify yourself, you can beautify yourself with it, and as long as you're removing it, it's like, you know, wearing dressy clothes, you come home and you change into your night suit, right?
Yes.
You want comfortable clothes at the end of the day, so you want your skin to breathe.
Right.
You wash your makeup off, you cleanse, like, you know, if you double cleanse, if you have your makeup, you've got thick makeup, you use a cleansing balm, you double cleanse nicely, remove your mascara, and you have to make sure that you keep your makeup brushes clean, you keep your beauty blenders clean. Have a few. If you're very lazy, use your fingers, always the best, the cleanest of the lot, and change your makeup. Again, the makeup now that we're talking about is very expensive. Once you open it, it gets oxidized really, really fast, right? So we think, okay, I've just been using a drop of foundation, so it'll last me a year.
Yes.
And that's when you end up with those melias on your cheeks and you come to me with like, doc, you know what, these little things, they just don't go. They're like acne on my skin, but they've just been here for about a year.
Right.
And that's because we're using older makeup.
So what's the shelf life of your foundation?
Once you open it, I would say 3 to 6 months max and you chuck it.
Okay. And the mascara?
Mascara
3 to 6
really
months.
has shelf life.
It basically,
Really?
yes, because
Apparently.
because again, see what happens is that you're using it with your eyelashes on a daily basis and you're putting the same brush inside. That's where the kota, and a person like you who's not removing the mascara really, imagine Sarah, what you're doing to yourself.
Right. Okay. I take that. Moving away from makeup to some of the treatments that we can do, that you might have done, that you might have tried. Some of them, of course, are high-end, expensive. Some of them more accessible. People now are investing in wellness and skincare, and they're doing things. They're thinking about their budget and they're budgeting accordingly.
True.
You've tried some high-end treatments.
Yeah.
What are ones that you have felt the benefits of?
Like I was telling Dr. Jyoti, I really like a Q-switch laser. I think the correct word is. I really like the glow it gives me. Like, this is the laser treatment I get at my Dermat's clinic, and it's the one which has no downtime. Like, I can immediately go back home also and apply makeup. I don't. I keep it for 24 hours. I like my skin to be. But it gives me a beautiful glow. Like, when I went to the Cannes Film Festival, before that I did it. Like, you know, anything special in my life, but I can get it regularly.
Right.
It's safe, it's lovely, your skin, the texture also evens out. So since I get those period acne regularly, every cycle, and I am very prone to pigmentation, I think just genetically. So even if I have a pimple that now I don't prick on, it'll still take, like that mark takes me 3 months to go. But say I do the laser, it'll take me like, it'll go faster. It'll take 1 month. So my skin evens out beautifully. Then everything is just looking really nice.
What's the deal with chemical peels and acne?
So the chemical peels that we had back like 10 years ago and the peels that we have now, they're very sophisticated. French products, great products. We've got like some lovely peels, they have zero downtime, there is no visible exfoliation, there is no visible scabbing. And again, how and where you do it is very important.
Right.
When an expert is overlooking you, we know when to neutralize the peel.
Right.
Right? It is not something that you do at home.
Right.
But when you do it in the clinic, it's very, very safe, very result oriented. It can really take away all those pills that you're popping orally, because I, as a person, I'm not really in favor of popping all those oral antibiotics when it comes to your acne. So it really, really helps that.
So if I have acne and I come to you and you say, chemical peel? How many sessions? How much? You said no downtime at all?
So no, when we say no downtime, there's no visible downtime, because initially there used to be physical exfoliation. You could see peeling of your skin, you could see visible redness, you could be scabbing. Right now that is not there anymore. So you need to do like one session, and then the next session would be 15 days apart. You've got a nice 15 days breather in between. You just don't put makeup for the first 2 days, we say, because you just let the skin be, and sun protection is paramount.
Right.
So you have to be very, very religious with your sun protection, and you need to do about 4 to 6 sessions individually, depending upon how bad and how severe the acne is. If like you're dealing with cystic acne, it could be more than 6 sessions also.
And what is the chemical peel actually doing to your skin?
So basically it's neutralizing the pH of your skin, the pH imbalance that has happened. It works as an anti-inflammatory for all the inflammation that you're taking in with your acne, and it is definitely helping us exfoliate the skin also.
Now with social media, some of the images, AI, filters, there's so much that's happening that can be worrying. And it can be difficult, especially for young, impressionable girls and boys, when you're looking at images that may or may not be touched up. And it's an image, it's a standard that everybody wants to achieve, but it's not really real.
Right.
Do you think about these things, Sarah? Obviously, when it comes to your content, it's fully authentic. Where do you think the line needs to be between achieving perfect skin and trying out these treatments, these wonderful products and treatments that are available now that can give you more healthy skin?
Firstly, for my content, I'm very strict that no filters, no editing on my skin tone, my skin, anything. Like even if I'm shooting for a magazine, and even now like I do bigger shoots, I'm very about no retouching my photos in any way. So I really appreciate when brands directly take it and use it as it was given when I'm giving the photos, or when they are taking it also, there's like minimal to no retouching, because that can really create like an impression in the young minds that, oh, this is what we want to achieve, when this is not even real.
Right.
And so that is something I strictly this. Now, I think with lighting, with different sort of lighting, you can also look different. This is something I've realized as a content creator who now creates literally non-stop. If I'm standing in like beautiful golden hour of my windows, that's when I look amazing, flawless. I always tell it in my videos that I'm like, guys, it's the light, it's the light. It'll just blur everything, the iPhone camera and the light. And there are certain angles, certain things that of course I, being a creator, now know about myself. Unflattering light, unflattering angles can also do the negative. Of course, with my videos, I'm not going to put myself in unflattering angles and lights. But I keep conveying that there's a limit to how much you see and aspire, because at the end of the day, it's your skin. You have to find your healthy boundary.
The fact that diet and exercise are so important when it comes to skin. And you spend time with your patients, understanding their routines, their stress factors, their lifestyles. So just for some of the viewers who do not really think about those things, can you tell us about the internal factors for good skin?
So for good skin, the cheapest and the most effective thing to do is hydration and sleep.
How much hydration?
Focus on hydration, 2 to 3 liters water a day, non-negotiable, and you have to, whatever that you add on it, you want to do your Nimbu Pani, you want to do your Naril Pani, you want to do your Chas, that goes on top of those 2 liters. So you have to make sure that you're hitting the 3 liters mark with the extras, and cut down on your caffeine, because that's dehydrating you. And so
I'm drinking water, you're drinking coffee.
Overcompensate. So you should know, right? You have to balance it out. So if at all you're drinking your 3 to 4 cups of coffee in a day, then you have to have.
Who is drinking 3 to 4 cups of coffee?
Well,
we're looking at you.
We're looking at you, Sarah.
Not me.
So yeah, so that and sleep. 8 hours of good sleep is non-negotiable. You have to have a set time that you hit the sack, and you have to make sure, because there's something called a biological clock.
Yes, and that's not 3 a.m.
Yes.
Sarah.
And irrespective of what we're doing, how busy we are, this is our only temple. This is the only house we have to live in. I could be a pauper and unhealthy. I will always be miserable, and I could be the richest man in the world, unhealthy in this body, nothing's going to make me happy. So if this body is healthy, I could be anybody, but I still will be a happier human being. So if I have to look at that one thing, if I cannot spend a single penny, you have to have your water and you have to have your sleep. And on top of it, if you could just pick up one product, I'd say sunscreen.
Right, yeah. I want to ask, because now I'm in my mid-40s, and this is the time where I get my free consultation, and you should listen, because at some point you'll be my age.
I will need
So, of course, dehydration, main concern.
Yes.
I'm hydrating, drinking enough water, using my moisturizers, using my sunscreen, getting enough sleep.
Yes.
But still the dehydration and the lines and wrinkles, which I'm embracing. I definitely don't want to be 18 or 25 anymore. I enjoy being 46.
Yes.
And But I see myself on the big screen, and not me, other people also say, oh, if you just, this line over here, if you just took that away, anyway, you look very young, but it's just this line that gives it away. So when people come to you, pro-aging, also a concern when it comes to skin. How do you manage that? Botox, fillers, all these things exist, and they're empowering choices for women.
Absolutely.
But at what point and where's the line?
Again, go to somebody who says no. You have to go to somebody who does not feed into your insecurities. Yes. Right? If I'm feeling insecure about something, that's me looking at myself with a very harsh lens.
Yeah.
Right? When you look at yourself in the mirror, you're looking at a 2D picture. When I'm looking at you, I'm looking at a 3-dimensional picture and the whole package that walks along with it. I have options, like you said, very empowering choices. We've got the Botox and the fillers of the world. We've got energy-based devices that really work wonders, right? But there's a fine line.
There are many fine lines.
Yeah, and your body stops making, your ovaries stop making estrogen beyond a certain point, but your body does not stop needing it.
Right.
Right.
Yeah.
So you need the collagen. So first 5 years post your menopause, your body loses about 30% of its collagen. It is going to show. There are going to be fine lines. There's going to be a little bit of dryness. There is going to be a skin that does not, the barrier is not going to feel as healthy. So that's where you seek help. A little bit of microneedling goes a long way. We create microchannels in your skin. We put some medications in it, hydrate it, like it's basically a long-term moisturization.
Right.
Do it on a monthly basis. Apply your sunscreen. Do your retinols at home. Works well.
Right.
Right. So if at all there is somebody who is not so insecure about lines and wrinkles, I don't want to tell them, oh, you know what, this line bothers me, fix it.
Yes.
If it does not bother you, it does not have to bother me. As simple as that. Walking to me, coming to me is like coming to a candy shop.
Right.
You may want everything, but is everything meant for you?
Right. But tell me about, for the instances where people do choose and somebody says yes, the Botox and the fillers. Are there any things to be concerned about? People have spoken about fillers. Do they actually work?
They're very safe procedures when done at the right hands for the right candidate. Patient selection is always the key. You should not rush into the procedures and you should not walk out of a clinic looking like a different person. So when you talk about a Botox, it's actually a muscle relaxant. What we're trying to do is we're just releasing your depressors. We're relaxing your depressors so the elevators can just elevate the eyebrows, right? So if at all I need a little bit of brow lift, doesn't harm me, right? It absolutely works well when you're needing very little doses before a wrinkle really etches into your face and becomes like a dynamic wrinkle, becomes a permanent line, is when you use a Botox. I am moving away from the filler practice gradually over the years because I'm more towards the regenerative basket now. I believe in regeneration. There are so many regenerative tools that are helping us retain and give you the look without volumization. But again, certain areas do need a filler, be it like if I have a short chin, I'm going to need a little bit of elongation with the filler. If I need jawline definition, I'm going to have to add on a little. If I'm looking at pulling the face, it's called liquid facelift, I may need a little bit. But a little bit goes a long way. A liquid facelift is where we use a filler to give you a non-surgical facelift. Again, start small and less is more. You don't have to do everything in the same setting. You build over a period of time. It's a gradual backward walk.
Sarah, what are your thoughts on invasive treatments?
I've done for acne scarring actually. That I don't remember the name of the treatment. They put that needle and they break the scarring.
Subcision.
Yes, subcision needle. That was an invasive treatment. Very painful that was, and very it was painful. But then I didn't see the results immediately, and that time I got sort of like a hollowness in my cheek. So what later my dermat explained to me is that I had anyways less fat over there. So I think with that a little bit of fat in that region got broken down. So I have like this sort of like a dent in my face when I smile really wide. Like I can see it. Nobody else can see it, but I can see it. So I wasn't happy that happened. But then later, and I also did not see a difference in the acne scars immediately after the subcision because like I told you, I used to pluck my acne. I had deep scarring. But after a year of doing 4 sessions of subcision RF, now my skin is even. So I think that really took its time and evened out my skin, and now I don't mind that dent because I look at my old photos and I'm like, what tha?
I think that what is important, I think, as you said, it's everyone's face, it's everyone's canvas, it's their own money, and you should have the choice to do that. The responsibility as someone in front of the camera, for you or for me, and for you as a professional, would be to present something that is truthful, something that is accurate, so that at least somebody is not trying to achieve something that doesn't even exist.
Absolutely.
And then, of course, it's your choice. If there's one high impact skin treatment that you could recommend to a client if they could only perhaps afford one? For me, microneedling. Vampire facials are part of that, like maybe a vampire facial with microneedling. I've been told that if I should do one thing, maybe I should do that once a month.
That works really well. Definitely, yes, it does. So microneedling works for almost everybody. The only downside is it comes with a downtime of about 24 to 48 hours, and not everyone can afford that.
Yes.
Right? So again, pocket size is very, very important. If somebody can afford a single session, like she rightly said, you can do a tri-beam or a Q-switch laser, which lightens and brightens the skin instantly.
Right.
There's no one size fits all, Soha.
Right.
So it's like you want to do one treatment, but what is your concern?
Right.
Is it pigmentation? Is it scars? Is it dry skin? Is it dull, uneven skin? Right?
Yeah.
So it is going to be individualized as per your need.
Sarah, if there's one key do and one key don't that you could tell people who are watching right now to improve their skin.
Oh, key do coming from an acne problem or concern would be to reduce your sugar intake. At least reduce, if not cut out completely. No more taking your coffee sweet, no having like iced teas and like these processed drinks. Look, small steps, because of course a younger audience doesn't want to stop everything.
Yeah.
Have your mithai na.
Even an older audience is okay.
Yeah, like Diwali aa rahi hai to mithai kha do, but then control is everything. So moderation is everything. I think cutting sugar is a key do. Key don't, coming from the younger Sarah, I really wish I was not pricking on my acne and like causing more infection in the same region. That also was like, forget the marks, those were only causing more acne. So that's for sure a don't. Like, do not touch your face. When my hands are dirty now, I'm so particular. Like, my hands are dirty, I'm not touching my face at all. I've become phobic about touching my face. So I no more touch my face when my hands are dirty.
Dr. Jyoti, if there's skin treatments, going to dermatologist, it's an added expense. And for some people, that's a concern. So if there's one affordable skin treatment or a product that you could recommend to people, then what would that be that wouldn't break their bank?
You could answer that for me.
Sunscreen.
It has to be a sunscreen. I have educated you all enough on that. It has to be a sunscreen, because even if I do a treatment for you, I am going to be exposing your baby's skin up, right? And if a young baby is born, you just don't take them out in the sun. And I can't practically expect you all to give me that kind of physical protection. So you're going to have to use a sunscreen with treatment, without treatment.
You interact with so many people through YouTube in your normal life. Is there one mistake that you see people doing on a regular basis when it comes to their skincare?
Yeah, overdoing it. I think getting influenced by influencers and purchasing everything on the market and like trying I always tell this to my audience also, this is my job, and after a point you need to start realizing that this is what I'm doing to educate you all that, hey, look, this is new on the market. Does not have to be for everyone. If you already have a skincare routine that's working for you, you don't need to switch it up. You don't need to buy something new. You don't need to.
And that's very candid of her to say that.
Yeah,
It's
absolutely.
really why, because you have to be wise with the content you consume, right? And if she's starting a new product, she's also stopping one.
Yeah.
That's something that you don't see.
Yeah.
And that's something I do to my skin, because I tell my dermat also, I was like, look, doc, this is my job. I am going to switch up my serums, my hair mask, my shampoo every week almost nowadays. Like, if lots of things are launching, it's overwhelming for me also. Then I have to space out my campaigns, the products I'm trying. I test it on myself, works for me then. So the minute I open, I know it's for a campaign, it goes in my bathroom and goes in my bedroom vanity. Then I try it, and so I keep switching my products so often. But then I have a dermat on the standby to fix anything that's like getting ruined on my face or my hair.
And that's a luxury.
And
that's a luxury not everyone can afford.
Exactly.
Yeah.
Since we are here, we'll take advantage of this luxury and say, if there's one common mistake that you see almost everyone doing when it comes to skin health, what would that be?
Popping your acne, not drinking enough water, and taking your sleep for granted.
Just attacking me.
Yeah, it's
She's attacking me.
I just want you to shoot.
And finally, one last question is that if you could give one empowering message to, especially the young women who are watching the show at this point, starting with you, Dr. Jyoti, what would that be?
I would say whatever that you're going through right now is a chapter in your life and not the whole story. So just be at it and do not give up on yourself. Anybody else, everybody else can give up on you. You cannot give up on yourself. And I think that is my take home from this conversation for myself, and I think for all of you all. We should just be at it.
Lovely. Thank you. And Sarah?
Same actually, very, very similar because I think from my personal journey and from anything else also that I've seen, I think your skin, since that's the topic of today, keeps evolving and you will evolve with your skin. And everything will change. You know, it's a dynamic organ, like Dr.
Yeah.
Jyoti said, it's the biggest organ, it's a dynamic organ. We're shedding our skin also every day.
Yeah.
Even when we're not doing anything, it's repairing itself anyway.
Yeah.
So we have to be patient with our skin and our lives in general. I think patience is the key message.
Yeah, I think that is very important, and I'm happy to see that there are responsible influencers like you, Sarah, out there that are good role models that we should aspire to and look to for informed content, that there are options, that there's professional help like you, Dr. Jyoti, out there when you need it. And as you said, patience and looking in that mirror, you see that you see that 2D image, but to understand that there's a 3D person as well who's looking at themselves. So thank you very much. I do have a small something to give you, things that I use and love. So this is just a small token of skin love from Bioderma and from All About Her.
Thank you
To thank you both very much for being on our show. Thank you. You don't have to open it now. You already.
क्या दिया है?
क्या दिया है? They're all very good. They're all very useful.
All my refills are sorted.
And thank you very, very much for being here, for being so generous with your expertise, with your time.
Thank you so much.
Thank you. Thank you.
That has been a really insightful conversation for me. And I do want to thank both Sarah and Dr. Jyoti for coming here, spending all your time, sharing your insights in such a brave, I think, and courageous way, for really breaking down the science behind skincare. Dr. Jyoti and Sarah for sharing your story with us. To know more about Bioderma's skincare range and to find the right sunscreen for you, please click on the link in the description below. And do remember, there's no perfect skin. It's about consistency, it's about care, and it's about finding what works for you. So whether it's investing time in a simple daily routine, whether it's protecting your skin from the sun, or making mindful lifestyle choices, every little step counts. If you enjoyed this episode, please don't forget to like, to share, and to comment below with your own skin stories or any questions. And of course, do hit that notification bell so you don't miss our upcoming episodes. Until next time, stay informed, stay healthy, and we will see you soon.